empower individuals and organizations to make a positive impact in patient safety. We would like to thank you, the Swiss Federal Quality Commission, for founding the Patient Safety Awareness Week. A special thanks goes to Melinda Kocher, who organized this webinar and is also support us today with the technical facilitation. In today's webinar, we will exploring the topic, the risk of language barriers, how to ensure safety communication in healthcare. We have prepared an exciting program and we warmly engage you to participate actively by asking questions or sharing your thoughts during the discussion at the end of the presentation. Before we start with the webinar, I would like to share a few technical notes. This webinar is being recorded. Unfortunately, we have to inform you by email that the Teams live translation is not available today due to technical reason. We are very sorry of this and thank you for your understanding. If you have any technical question, please feel free to use the chat function. For all content-related questions, you can use Q&A, which we will be reviewed both by me and our speakers during the discussion part of today's session. Now, let's begin. Today's webinar agenda is as follows. We will start the presentation by Anne-Catherine Gieshoff, followed by Loraine Olalia, and then Lena Emch. At the end of the presentation, we will have time for a discussion and Q&As. Now, I would like to introduce today's first speaker, Anne-Catherine Gieshoff, Research Associated at the ZHAW Institute of Applied Linguistics, completed her doctoral studies in translation study at the University of Mainz and is currently heading the professorship for interpreting study at the Zurich University of Applied Science. A key focus of her research explored in several projects is the use of translation technology and professional interpreters in healthcare. She is also the co-host of an academical podcast named Minds Between Languages and a member of several professional organizations. And without further ado, I invite Anne-Catherine to take over. Thank you very much.
Thank you very much for this very kind introduction. It's my pleasure to be here. And yeah, I will talk about one of my favorite topics, the use of translation apps or use of machine translation in healthcare. A little bit with the focus of machine translation and or interpreters. Many of you probably use both. But let me start just with a couple of numbers and figures. Because language barriers in Swiss hospitals are real. You know that probably. But I was amazed also to understand that 40% of the people living in Switzerland have a migration background. That's how it starts. And 74% of the nurses in hospitals encounter often or even daily patients with whom they cannot communicate in German. And that was one of the results of a bachelor thesis that was conducted at our university by Librani and Vukadin just 2 years ago. You can see it's quite a huge number actually, 74%. That's 3/4 of the nurses in the hospitals. In another bachelor thesis, Laukat and Grilli, I found that 73% of the midwives, so they were focusing on midwifery, have often or sometimes contact with allophone patients. So again, also in midwifery, we have quite huge language barriers. And we found now in a very recent project, it is not almost concluded, but not yet entirely concluded, that almost 60% of healthcare professionals, so that is nurses, medical doctors, all kind of professions that you might find in a hospital, encounter at least once per week a patient with whom they cannot really communicate in the local language, so German, French, or Italian. It's quite a huge number. And from a study among family doctors, we know that there are 36% of family doctors who see at least once per week a patient who does not speak the official language sufficiently well. So there was a study conducted by Jäger et al. That has nothing to do with ZHAW, but was just another study. So we can see that we have language barriers everywhere, actually not only in Swiss hospitals. The heading here says Swiss hospitals, but as we can see, it's not only Swiss hospitals, but it concerns also family doctors and midwifery. And this, of course, leads to a number of challenges. And I took here a quote from the bachelor thesis from Dibrani and Vukadin. This is one of the nurses that I interviewed, and she said, "No, the main problem is that we cannot understand each other. That means that I cannot respond to the needs of the patient, and they do not understand their analysis or results, which leads to problems during nursing." And this is, in fact, one of the main challenges that we can see in this bachelor thesis. So difficulties to communicate with the patient, difficulties to assess symptoms, so taking history, which also leads to difficulties, of course, to establish a clear diagnosis. That important, I'm sorry about the typo, important information is not understood by the patient. So for instance, they don't understand how to take their medications, which of course can pose a serious risk for them also, if you think about secondary effects. But the healthcare professionals have the feeling that they cannot really respond to the needs of their patients, which also leads to frustration, misunderstandings, which can have huge consequences also. This kind of feeling of uncertainty and stress because you say something, you're not really sure whether it's understood, you're not really sure whether you understood actually the request. And sometimes all these challenges and issues around communication can lead to reduced communication. So healthcare professionals retaining explanations, let's say, or information that does not seem absolutely essential to them. And also the fact that it is very time consuming to communicate with allophone patients. So these are other things that I already mentioned, but patients cannot really express their needs. Lack of trust, also a problem. So these are the communication challenges that we observe. If we look again at that study by Jäger and her team, and we look at the impact on family doctors, it's, I think, even clearer. The impact is even clearer. So we have, again, this feeling of uncertainty if the patient understood actually what has been said. We have higher consultation durations. So again, consultations being more time consuming, and we know time is money. Again, this feeling to be unable to respond to patient needs, the difficulty to establish a diagnosis, to develop a treatment plan, forgoing explanations, right? You maybe do not communicate all information, all the explanations in such detail as you would if you could just speak in your local language. So Jäger and her team also looked at the use of lay interpreters. So for instance, members of the family or friends that, translate between the patient and doctor, sometimes also his children doing that. And then you also have this problem of lay interpreters who do not interpret everything. So which is why it is important to have qualified interpreters. I'm sure that Lena Emch will say a couple of more words about that. Also the difficulty of having sensible conversations, delicate conversations, often intimate topics with the patients. If you're already challenged by all these communication issues, it can be very difficult actually to discuss, serious situations and complex cases, of course, end-of-life situations, for instance, where you need to take decisions. So these are some of the complications. And then, of course, not to forget unnecessary hospitalizations, right? Or you refer the patient to emergency because you're not quite sure whether you understand correctly what is said. So we can see that the impact on family doctors, on healthcare action more generally, is quite there's a quite large impact actually. And if we look now at the communication strategies that those healthcare professionals employ to communicate with the patients, and we kind of summarize all this data from different projects that we have conducted at our university or the bachelor thesis that we have conducted, we can see that we have machine translation as one of the main communication strategies. Actually, many healthcare professionals use machine translation. We had a master thesis in 22 year that was conducted by Grant, and he surveyed German hospitals on the use of machine translation, and he found that 80% of healthcare professionals already used machine translation, so translation apps such as Google Translate, back in 2022. So it was already a thing. And then the second big strategy that we can observe is the use of relatives, family members as lay interpreters. And then nonverbal communication or gestures to communicate with allophone patients. So these are the main strategies. The use of qualified interpreters, well, that seems to come a little bit later. Qualified interpreters are used, but as we will see, in much more complex cases. They are only called rarely, also, I mean, for the reason that, of course, there's a budget behind. But now, using translation apps, as magical as they can seem sometimes, because they provide more or less immediately this translation, and it doesn't cost a thing, and that's all very wonderful. Machine translation apps also come with some challenges. So after Grant in 2022 has conducted his master thesis, my colleague Carolyn Lair and me, we conducted interviews with some healthcare professionals, a couple of nurses and medical doctors, and we asked them about their experiences with translation apps. And one of the doctors, gynecologist, if I remember correctly, said something very interesting. She said, well, I think you need some intellectual skills to use these tools, because you need to know how to formulate a sentence in different ways. And not everybody is able to do that. So she was explaining, actually, if you want to use translation apps efficiently, you need some kind of literacy. And this level of literacy in reformulating sentences, for instance, also in just using an app, is not something that all patients have available. Some come with kind of lower level of education, for instance, and that can be very difficult for them. So if we summarize the interviews and what they mentioned, small sample to say that I think we had 10%. I know we had 10 participants. So 8 of them were mentioning the risk of mistranslation and also of serious misunderstandings. There was one person actually telling a story where the use of translation apps had led to a serious misunderstanding, and it took them half an hour to kind of calm the patient down and clarify the whole issue. 4 persons mentioned that nuances are lost in communication. So the communication works on a rough basis, but then some details are lost. And so for complex cases, especially when you discuss the impact on life, for instance, kind of impact that a disease can have on people's daily lives, or I was going to say, a treatment that can have also an impact, of course, that can be very difficult to have those discussions. They also noticed that using translation apps is very tedious and time consuming. So the translation app doesn't always capture very well what you're saying, so you need to repeat and you need to reformulate, and so it goes back and forth, and that can be very frustrating also. Then at that time, data protection was a huge issue. At that time also there were not a lot of specialized translation apps for healthcare, so usually what was used was Google Translate or maybe DeepL. Now there are quite a lot of startups that also suggest translation apps that are actually, at least the developers say that they are safe in terms of data protection. Some also said, okay, it's kind of impersonal use of translation apps. It's kind of in between you and the patients, like a communicative barrier. So there were these kind of challenges, and also what we have seen already, the fact that it requires cognitive skills actually to make efficient use of translation apps. So Grant, when he conducted his master thesis, he was interested also to know, when do healthcare professionals actually use machine translation, and when do they use qualified interpreters? And he had, I think, 2,080 healthcare professionals who responded to his survey. And here are some of the situations they describe. And these numbers here in brackets, they indicate, for instance, here, the first number indicates how many would use machine translation for the situation. And the second number indicates how many would use interpreters for that situation. So 69 persons, for instance, said, let's put it differently, 65 people, for instance, said they use machine translation to ask the patient for their well-being or to ask simple medical questions. Are you thirsty, hungry? Have you already eaten, or have you already drunk something? Then also to give information on upcoming treatment or nursing activities. That was something where I use machine translation a lot. Also to schedule appointments, or just for everyday communication, right? Is your sister coming today? How's your dog going? How's your dog feeling? And then we have situations where they use primarily qualified interpreters. For instance, in emergency situations, in complex cases, or when you need to require consent for surgical interventions, for instance, or when you need to have long and complex conversations with the patient. At that time, the long and complex conversations were not really defined, so we did not really understand what the respondents meant by that. Now we start having a little bit more understanding, thanks to the EMIT study. That can be conversations such as psychotherapy, also end-of-life discussions, and very complex and difficult topics. Yeah, and conversations with relatives. So if you have the whole family around and you have round tables or something like that. And then also there are a couple of situations where there's no real decision. For instance, for admission and discharge or the ward round. So that could be both interpreters being used or machine translation. For simple cases, if you're taking the history or if there's a consultation for a simple case, again, there's no clear decision. To educate patients about a disease, again, no such a clear decision between machine translation, qualified interpreters, and also a couple of cases were simply unclear. So based on that data and based on interviews that we conducted, we then came up with this decision tree, also that you can download if you're interested. Very unfortunately, it's just in German, but I will briefly explain to you how this decision tree works. So you have 3 types of situations. One are very easy situations that should be familiar to the patient, situations that do not involve any complex terminology, and where you have a very low risk for the patient in case of misunderstandings. So in these situations, machine translation can be a very efficient solution also, especially if you don't need to use names or other sensible or personal data. And then we had the red situation type here. These were the very complex situations that are really terminology complex, emotionally complex, where you actually want long-term compliance and where misunderstandings really can have huge consequences for the patient. In these types of situations, we recommended in-person interpreting. And then we had a type of situations that was not very easy, but not so complex neither, where the situation is a little bit less familiar to the patient and maybe a little bit more complex, but where the consequences or the risks in case of misunderstandings, again, were not very, very serious. And in these cases here, we recommend either telephone or video interpreting services. That was 2002, and now again, we are now in 2025. And since this year, we have a new project where we actually try to tackle exactly this question, overcoming language barriers in public institutions and also hospitals, of course. And this is the DigiLingual project. The DigiLingual project has 3 pillars. So one, and I think that's the pillar that is most interesting for you, that's the test track. So we are building up a library of digital translation tools. And if you're interested, you can come and test different tools. We also conduct small studies. Then we have a networking activity, which is called meetups. And these are stakeholder events where everyone can meet, all stakeholders can meet and also exchange best practices. And finally, an online training platform for interpreters and also interpreter trainings where you can find a lot of teaching materials. So we are really spanning everything from digital translation tools to interpreting services. So, and with that, I think I'm a little bit even over the time. Thank you very much for your attention. You find here 2 QR codes to find out either more about the DigiLingual project, and we would be happy to meet you at one of the stakeholder events, maybe, if you want to contact us, and the other one for to access the decision tree. Thank you very much.
Thank you very much, Anne-Catherine, for this very insightful presentation and the interesting data and the helpful decision tree. To all participants, please feel free to submit your question via Q&A section. All questions will be collected and addressed at the end of this webinar. Now I'm delighted to introduce the second speaker. Loraine Olalia is the co-founder and a UX/UI designer at Talking Picture, a picture-based communication tool designed to overcome language barrier in healthcare. After studying visual communication, she conducted research at the Bern University of Applied Science on design, health, and digitalization before founding Talking Picture as a spin of the Berner Fachhochschule in 2025. She works with others to create inclusive ways that help healthcare professionals and patients communicate better. Please, Loraine, the floor is yours.
Thank you so much, Thomas Steffen, for this kind introduction, and good afternoon, everyone. And yeah, Talking Pictures is a spin-off from the Bern University of Applied Science and is based on an interdisciplinary research project to address a critical issue that is language barriers in healthcare, specifically in Swiss pediatric emergencies. And today I want to share how we developed an evidence-based visual communication tool that's now helping healthcare professionals and patients to overcome language barriers and improve patient safety. When we interviewed healthcare professionals about their experiences, this quote, it's a bit similar to one that Anne-Catherine showed, this quote from a pediatric nurse that really stuck with us. And and then they talk to a wall and we talk to a wall, and that is very difficult. For us till today, it perfectly captures the frustration, helplessness, and insecurity that both sides feel, health professionals and patients, when basic communication is not available. So language barriers in healthcare, as we already heard in the previous presentations, can lead to misunderstandings and negative feelings and to many following problems. And to say it in numbers, we have the similar sources like Anne-Catherine showed. More than 90% of primary healthcare providers in Switzerland face relevant language barriers at least once a year, 36 even once a week. And it is a major challenge for health professionals, and it has a negative influence on the patient's treatment process. It can lead to over or under treatment or even incorrect treatment. And as a result, language barriers also increase healthcare costs. That's why clear, comprehensible communication is essential for safe and high quality care. So this led us to our original research question, which was, to what extent can a set of pictograms visually support relevant questions so that language barriers can be overcome during the initial contact between foreign language patients and nursing staff in pediatric emergencies? To address this challenge, we adopted the human-centered design perspective and a participatory design process. This approach was essential to ensure that our solution would meet the real needs of both healthcare providers and patients. And this was done with the interdisciplinary research team, with the researchers from design, nursing, and also medical informatics, and of course, with the involvement of the end users. We started with analyzing the problem. We analyzed existing communication apps, surveyed pediatric emergency departments, and interviewed nurses to understand current challenges and strategies. And then we defined the requirements for a communication aid based on clinical needs and user feedback. And after that, we developed the visual communication aid through iterative prototyping and the design of the user interface. This then followed to the solution, where we also again conducted the comprehensive testing, both of image comprehension tests and also the user testing session with healthcare providers and patients. And this systematic process allowed us to move from really understanding the problem to delivering a functioning prototype based on real user needs. And some finding of the questionnaires and interviews was that language barriers are really experienced almost every day, and there are few to no aids to overcome those language barriers. They often communicate with hands and feet or use Google Translate, which is not sufficient in terms of correct translation, especially in the medical context. Already also mentioned data protection and or available languages. And this research also revealed specific requirements for healthcare professionals. It needed to be something really quick to use, easy to operate, and compact to handle. The visual elements had to be clear and universally understandable, and also available in multiple languages. And most important, it has to fit into the busy workflow of emergency care. So based on these requirements, let me check that the video is working now. Based on the requirements, we developed Talking Pictures, a digital web app complemented also by printed materials. It contains over 180 designed illustrations covering the most common conditions and procedures to support in pediatric emergency assessments. The images are, as you can see, organized into categories like symptoms, pain scales, accidents, that follow standard triage procedures. And the user interface is clear, allowing for very easy navigation. How it works is rather simple. Rather than a simple translation, it enables a visual dialogue. For example, when you select an image, the system shows related follow-up images covering timing or associated symptoms. And this creates a structured conversation that follows a known clinical logic. Also, all terms above the images are translated professionally into over 20 languages, including like the less common ones like Tigrinya, Dari, or Somali. And the user testings have shown that the prototype meets the need of the users in terms of functionality and content. Nurses and parents generally got along well with the app, and the images were found to be appealing, easy to understand, and helpful, especially for a quick assessment of symptoms or the course of an accident. And the user testing also revealed, of course, a lot of potential for improvement, such as missing images or functions, especially challenging for comprehension were like time specifications. For example, how long a condition has lasted, since when it has lasted, or also questions about pre-existing conditions. But looking at the pictures together, supplemented by gestures, mimics, and language, allowed for an empathetic dialogue. So what we've created is something that fills a crucial gap in healthcare communication. It's positioned between basic hands and feet communication and full professional interpreting. And for those everyday situations that are too complex and for gestures, but don't require a professional interpreter. It would also be interesting to see where talking pictures is positioned in the decision tree that Anne-Catherine showed before, if it's in situation 1 or 2, of course not in 3, but maybe between 1 and 2, but it would be interesting to check this. But what we know is that the visual approach creates benefits across the board. Patients get better quality of treatment and increased safety, and healthcare professionals save time and experience less stress during consultations. And institutions see improved efficiency while reducing errors and follow-up costs. We've been piloting now the talking pictures in several Swiss healthcare institutions since 2022, and the results from healthcare professionals have been really overwhelmingly positive. Almost 99% of surveyed professionals would recommend talking pictures to their colleague. And what's particularly encouraging is the range of users, from paramedics to social services to specialized care facilities. It shows that visual communication really can work across different healthcare settings. And we are also now expanding from pediatric emergencies to developing a specialized image set for geriatric care and general hospital care. And what we've learned is that visual communication fills a critical gap in the already available toolkit for addressing language barriers. And it is not meant at all to replace professional interpreters for complex discussions, but it provides immediate, accessible support when interpreters are not available or for routine assessments. So, however, when pictures are combined with other translation services, language barriers can be effectively addressed. And this one approach that we have, the visual approach, empowers patients with diverse linguistic backgrounds by offering a language-independent tool and thereby fostering a more understandable and safer patient-practitioner dialogue. Yeah, thank you for your attention, and here are our contact details if you'd like to know more about us.
Thank you very
so
much. Thank you very much for your interesting presentation. You certainly added a new innovative perspective to today's topic. Again, if there are any questions in regard to this presentation, please submit them via the Q&A section. And now, last but not least, I would like to introduce the third speaker. Lena Emch studied ethnology, political science, and history in Bern and Berlin. Since October 2021, she has been the managing director of Interpret, the Swiss Association of Intercultural Interpreting and Mediation. Lena Emmerich, the verse is you.
So thank you very much for your introduction, and hello to everybody from my side. So I hope you see my presentation well. Let me just begin with some general thoughts about, well, you have now heard a lot of arguments or you have heard a lot of situations where people are confronted with language barriers. You've heard a lot of ways to communicate, also different communication tools. We have also heard a lot of arguments to work with interpreters, but what is a qualified interpreter? And I would like to start really give you a short idea of what we are, who we are, and why I'm talking to you. Interpret is an independent association, and we are committed to professionalization of interpreting, among others also in the field of health. And since its founding, Interpret and community interpreting has been receiving significant support from the federal and cantonal authorities. So how we are organized, as you can see, we have a competence center, and just let me, when talking about interpreting, I was looking for the right term of Nationales Kompetenzzentrum or Centre de Compétence. I'm not really happy with the translation, but I hope you'll understand me. So the Competence Center, this is the hub for information, conceptual work, and public relations in the field of interpreting. And for that, we are in contact with local, cantonal, and national authorities, but also with the regional interpreting services. So if you work as a health professional with an interpreter, most of the time you will be in touch with a regional service, interpreting service. And then beside the competence center, which is really the core of what we do, we have the qualification office. It defines and monitors standards for the training, but also, and really important, for the examination of interpreters, thereby making a significant contribution to quality assurance. Because when you are working with a person on site or via video, you want to be sure that the person interprets. And I want to give you some ideas really shortly about what that national qualification system for interpreters means, and it's unique in Europe, I must say. Maybe it's in the world. So we have a qualification system. It exists since 2004. And this qualification system is it combines, let me start with that. It combines professional experience and training. So this is really special because we learned when Interpret started, we learned that people are already interpreting in hospitals, and because they know the language. But we saw that it is really important to give them some training. So that's why we decided to offer a non-academic education path. And this non-academic education path leads to 2 qualification levels, as you can see on the lower in the lower part of the picture. You see the Interpret certificate. It represents the basic qualification for interpreters, and it is recognized as such all over Switzerland. And until now, we have more than 2,000 persons who have received this certificate since its introduction in 2004. For further training and a specialization in the focal areas, so this is asylum and justice, education and social affairs, and health, our qualification system leads to the Federal Diploma of Higher Education. This means it's a Eidgenössischer Fachausweis or Brevet Fédéral. And this higher diploma, we introduced it in 2008, and until now, we have a total of almost 190 persons who have received this higher diploma. So it's when you're working with an interpreter, it's not just knowing languages, it's really to know, to interpret. But it's when we're talking about interpreting, we have also, it's really important to talk about a code of conduct. So I would really, really briefly just list the key aspects. This would be a long other 10 minutes to discuss with you the really key concepts of this code of conduct. But it really shows you the difference when you're working with a person who is qualified. If you think about, you could also work with people just passing by, I mean, like children, relatives, friends who are interpreting. All these persons, maybe they want to help, of course, but it's really much more than helping people to communicate. So, and then I want just finish really my really short presentation with a example. It illustrates really why we need qualified interpreters. So recently I've been in contact with a foundation that is committed to supporting families of seriously ill children. So it's children with a complex and chronic clinical picture. The foundation relies on volunteer service providers for its work, and they've been contacting me because they were looking for some possibilities to work with interpreters because they can't afford professional interpreters. So I've been in touch with them. And they've been talking about a child with insufficiency developed swallowing reflex. A child cannot feed independently. A PEG tube is inserted. So and these professionals, they are in regularly contact with the parents. And what they told me is, why should they need to work really with an interpreter? It's the healthcare professionals, they need to discuss sensitive topics such as prognosis, illness, ethics, but also end-of-life wishes and bereavement counseling with the parents. And beside that, of course, the clear communication is an issue, but also the cultural backgrounds and being able to respond to them, to all the questions. Also, when we're talking about these kind of really serious situations, you have a lot of situations where you're talking maybe about taboo. And so this is something really important you need to know. And the professional interpreter can help you to solve these really, really difficult situations. But it's all, and then it's also the reflection and evaluation of nonverbal communication, which is something that is you'll face it everywhere, and this makes really the difference when you're working with a person instead of working with machine translated communication tools. And last but not least, they gave me a list of aims of working with qualified interpreter, and I really want to cite that because it shows why it is so important to have qualified interpreters. They can ensure a professional and sensitive, empathetic care and counseling, but also they're relieving the burden on the family, because if you think about that family and the sister of that child has to translate what they're talking about, this is a situation we really don't want to get into. So that is really why we need the qualified interpreters. And beside that, it's also strengthening parental decision-making skills, but also ensuring that decisions, and you've already mentioned it, Ann-Kathrin, I remember ensuring that decisions are made in an informed manner and in the best interests of the child. So this is just to give you an idea of why we need qualified interpreters, and I will finish my presentation with that. Thank you very much.
Thank you very much, Lena Emch, for this interesting presentation. Now we can change to the discussion, and I will take the first question from Q&A, and it's the question to talking picture, how to get the talking picture app, and what will that cost?
The Talking Pictures app is available in the App Store or Google Play Store. You can just search for it under Talking Pictures, and there it costs 20 Swiss francs. It's a one-time fee for the current version. But if you want to use it in your institutions, we have special license fees depending on how many devices you want to use it on. And for that, you can contact us directly.
Yes.
Yeah.
Thank you very much. Another interesting question is the question of the legal situation, the question of the liability. If I have a translation machine, and I make a mistake by the translation, what is the legal consequence for that? Have you some idea about that? It's not a classical medical advice, because it could be everything. Is this the fog of unclearness of the new technology? Is it possible? Anne?
So I do understand the question correctly, right? The question is, if I make a mistake, if I establish the wrong diagnosis, I give the wrong treatment because Google Translate made a mistake, who is responsible for that? Very good question. It's not solved yet.
Yeah.
So right now, most of the, let's say, efforts are concentrating on guaranteeing privacy and data protection, so that at least you could use the app without, like when we developed that decision tree, we recommended also to not use names, patient names, any personal data or very sensitive data or something like that. Now with new startups that guarantee data protection, so still probably you would like to check that internally in your institution, but let's take that as I said. Let's say it's guaranteed. At least now you could enter personal data. You could use that without any fears or concerns or so.
Yes.
But the question of liability is not solved yet.
Thanks. Lena?
Thank you. Yes, as Ann-Kathrin said, it's not yet solved. But what we can do now is really to talk about communication tools and what they can. What are the chances of the communication tools and what are the risks? And this is really something that it's really the healthcare professionals who have to be aware of the different chances and risks, and then really decide what kind of communication tool do I need in this very situation. And this is something that only the healthcare professional can decide, because he or she knows what the situation is and what they want to say and what maybe the consequences is. So this is a lot of work still to do. We are working with cantons, but also with national authorities really to work on this really huge information and sensibilization tasks that is still really open, and there's a lot of work to do there.
Yeah. Thanks. I see in the Q&As that the spin-off of Loraine makes a lot of flow to question about taking picture. First, would you recommend using the Taking Picture app while traveling in foreign countries with kids in case there is an incident?
We haven't tested it yet. We don't have like a patient version for it. Well, that will be like the patient has the app and will go with it to the hospital. So it was not intended for this use case. But as we can see, other people are coming to us and say, "Hey, we used it for children with autism, and we also used it in a home for elderly." So it's being used also in different contexts, but we haven't tested it yet. Yeah. But maybe if the person wants to test it in holidays, we are always happy to hear feedback. Yeah.
Yes. And the second question is also a new business question. Have you some ideas about expand the icons in other topics like adults, intervention, risks, and so on?
Yes, of course, we want to expand the image sets. For next year, we plan to develop an image set for geriatric care and hospital care. But of course, it's always a question about funding. We are an association, a Verein, and we are always looking for implementation partners. So yeah, but it is the plan that we cover as much healthcare settings as possible, but it needs time and money, of course.
Yes, very interesting. The next question is the question of the development of the technology. Is there some topics or some ideas about professional interpreters via live videos and so on? What goes on this part of the market? Live videos. We have this, for example, in pharmacists. You can, or medical service with apps like Medicare and so on. Lena?
Well, Ann-Kathrin Gieshoff already made kind of showed you the differences between on-site interpreting and video interpreting, and it's really you have different questions, or you have to be aware of the technical things like internet and stuff like that. So but also, what do you see in a camera? So this is something that people normally they don't think about it. What do you see, and does it help you to really to get a better situation than just via telephone? You can also do it via telephone, but of course it's a huge difference to see the person in on the screen. But still, if you have really complex situations where you have, for example, also not just 3 people or 2 people, but different persons talking, and then you have like it's really also to have somebody on site. It's also about trust, and it's also about building up a relationship between patient and healthcare professional, and this is just something that is much easier. But again, I think it's a huge chance to have video interpreting, because it gives you really to react in a quite short time, to have somebody who interprets for you. So this is really a huge chance to help to communicate. So I would say yes, think about it, but also then think about what works and maybe where are the risks. But Ann-Kathrin, you can tell us also some ideas.
I'm just maybe complementing. So video interpreting services exist in Switzerland, right? Less such as phone interpreting services. Lena didn't say it that clearly, but it exists. And the problem usually with that is it's very useful also in many situations because you can get an interpreter much faster than you can use an person interpreter, and it can be tremendously helpful. It can also be very helpful now compared to translation apps, because you will be more certain about a communication. So there will be less kind of this, did you really understand what I was trying to convey here? So that there's more kind of a basis that is established. Usually the problem with video and sometimes also phone interpreting is just kind of the Wi-Fi is not sufficient, and then you have all these technical challenges, and then it really becomes frustrating again. So it depends. Very unfortunately, we're living in Switzerland, a country where we have 6G, right? 5G, 6G, and very unfortunately, in some places, then still this is not enough actually to establish a really stable connection for video or phone interpreting services.
Yeah. Thank you very much. I come to the end question to all three speakers. I like a question with time machine. If we go, what will I say, 10 years in the future, what will the situation be on this field of language and patience? What will go on? What is important for you? Can I start with Loraine?
So, well, our kind of vision is that there is a tool or the tool that helps to overcome language barriers, not only visually, but that all the senses are like covered in one tool, so that depending on every user's need or on every setting, that there can be a tool or one tool that covers like all the needs, but like not only visually, but you can call interpreter or have a machine translation depending on the situations that you're in. That there's something available, because it's always a question about availability in these situations.
Thanks.
Yeah.
Gieshoff?
Yeah, thank you very much. Very interesting question, right? What is the future of communication? Of course, it's difficult to say, right? Because there can be many developments, many things also that we have not anticipated finally arrived and so on. But I think something that will be crucial is also whether developers will be really listening to the needs, right? How much they actually gear their tools towards the needs of hospitals, healthcare professionals. And I'm not always sure it is actually done properly. And also sometimes things are promised that actually cannot really happen also. Yeah.
Thanks. Lena Emch?
Thank you. Well, there will be a huge shift from, I guess, computer-assisted communication tools will get more and more important. But I would say people, they have to learn that there is a huge difference in working with a computer-assisted tool and a person. And if you're talking about persons interpreting, then in future, it will be even more important to have a qualified person, because this is really where you feel and where you see the difference. If you want to work with a person on site, and there are some really good arguments in difficult situations to work, I would say still in 10 years with persons as interpreters, you need a qualified one. And that's why we have to work still on do the qualification and to give chances to people to qualify and to do this really, really important work that helps in the end, not just the patients, but also the healthcare professionals.
Thank you very much. This is very important. It's 3:00. We have now to come to the end of the 2 days webinar. On behalf of the Swiss Patient Safety Foundation, I would like to sincerely thank you, our speakers, Anne-Kathrin Gieshoff, Loraine Olalia, and Lena Emch, for this insightful presentation and the reflection of this important topic. You have shown us how language barrier can affect patient safety and what is the strategy can help to ensure clear, safe communication in healthcare. A big thank you goes also of all of you our patients for joining us and for your engagement in this important issue. We hope today's webinar has provided you with good ideas to take back into your daily work. Before we close, just a few short notes. This season is part of the Patient Safety Awareness Week 2025. We warmly invite you to join the next two webinars taking place in this week. Tomorrow, medication dosying. Christoph Berger give clinical insights on pediatric drugs dosing in his lecture, Efficiency and Safety in Drug Dosing for Children. Then the day after tomorrow, Gender Medicine, Anne Röhle will introduce gender-sensitive medicine, showing how consider biological and social culture factor which benefits everyone by improve health quality and patient safety. In addition to the webinar, we have on our homepage quiz series consisting of several short online quizzes on various topics. Secondly, you will receive a brief evaluation form by email after the webinar, and finally, a recording of this webinar will be uploaded to our website so you can rewatch or share it with colleagues. And with that, I will close the today's webinar. Thank you once again, and we wish you a successful Patient Safety Awareness Week. Have a lovely afternoon and goodbye. Thank you very much.